MN669 Unit 10 Journal. Unit 10. Wow. Okay, so what goals did I set for myself? Um, um, um. The goal I always set for myself is to conduct these videos in a professional manner without using the word so much. And so I did some research, and a gentleman was saying that if you have your words, your communication, your what you're going to talk about uh, planned, then you won't use the word so much. So the reason I use the word so much is because when I do these journal assignments, I'm just freestyling. I'm just talking. It's not planned, it's not scripted, but I still want to be able to do that without using the word so much. So I don't think, when I look back on these videos and reflect or whatnot, I don't think I've said the word as much as I have in the past. What feelings, prejudice, biases did you experience during your clinical experience? I did not experience any biases or prejudice. My feelings were, I enjoyed it. It's like therapy. I love, love, love going to clinical. I love seeing patients. I love talking with patients. I love getting the history. I love just opening up the door and seeing a new face and talking to new people and new personalities. I love to hear the success stories of how they're doing good on their medication regimen, and therapy also. I also love to hear patients come in and speak about what's not working, because that is what I've noticed, even speaking with friends and families. A lot of people don't talk about what's not working. Instead, they stop the medication. And that is not the proper thing to do, as we all know. So I just enjoy it. I enjoy it. I really like when people come in and say what's not working and what they're experiencing and what's the side effects, and how they talk about how they want things to work, how they want to get better. I just love clinical. That's my feelings about it. I just love it. How did I manage my anxiety, self-doubt, uncertainty? So, as I said before, I am a family nurse practitioner. So I went through that program here at Purdue, and I think my anxiety all went away within that program. And the way that I spoke about this before, the way that I was able to overcome that anxiety is I would tell myself, the patients don't know you. The patient sometimes will call you a doctor. The patient just have all the faith in you until you prove them wrong, I guess. So that helped me overcome my anxiety, because I wasn't being judged. The patient thinks that you know your stuff when you walk in that room. Like, they're there to see you, to get the help, and they believe that you know what you're talking about. So with that, and then they didn't know how new I was, how long I've been in the program. They didn't know if I was new at this or not. So they weren't judging me. So it was no need for the anxiety that I did have. So that quickly went away. And here at the Psychiatric Mental Health Nurse Program, there's no anxiety at all. Insights did I develop during my clinical experience? Understanding or insights? What I've learned and what I understand is that you must remain professional at all times. You in front of the patients. You must be careful when it comes to me communicating with patients, especially psych patients with mental health disorders. As I spoke on before, you would think that you're having just you think that you're doing the patient a service by listening and responding and giving your opinions and asking questions. And I've learned that the biggest thing that I've learned is that's not proper. That's not what you're supposed to be doing. There is strategies in place. There is therapeutic communication. It's what do you call it? I can't think of the word or the therapy where you are basically, you listen to what the patients say and then you repeat what they say. And it's a word, it's a therapy. I can't think of it right now. But it's a way that you communicate with patients. You don't communicate with the patients as if you're communicating with your friend. And I've learned that. I've learned that the hard way. And one of my coworkers learned that. And, I had to share with her my experience and my knowledge, what I've learned, how you deal with a patient coming up to you, talking to you, telling you what's going on or what happened with them, how you respond. You don't add to the conversation. You simply repeat what they say. So what I hear you saying is, and you repeat what you heard them say, and they accept that. So I think I would accept that too if someone was having a conversation with me and that's how they responded, because a lot of times we want to vent to our friends and family. We talking a lot of stuff, but we don't really want any criticism. We don't want any advice. We don't want any, and it's weird because that irritates us sometimes where, oh my God, I did not ask her for no advice. I already know this. Like, you thinking to say it in your head, or sometimes you say it out loud. So that is a great way to communicate. And actually, I just thought of that right now. That is how I will respond to my friends when they are clearly venting. So that's that. Has reflective practice impacted you as a person, student, or provider? Of course, reflective practice has helped me as a student and as a employee, because I often reflect on, if a situation is happening, I would reflect on how I responded previously and how I should respond based on the outcome of the experience in the past. So reflective practice is awesome. And of course, I will continue reflecting. That's how you learn. You learn, I won't say everything that happened in the past is a mistake, but you learn from your past. You learn from experience. You learn from reflecting. So I really enjoy reflecting. I really enjoy these journal assignments. And that's that. All righty. Thank you.